right, why I had my amalgams removed. I didn't know that it was really a bad thing. I didn't know anything about it, of course. Growing up, I had a mouthful, just like probably most of you guys do. You guys know what I'm talking about. Okay, mercury goes through your entire body. Now, and one thing, just to make sure you guys really understand this, there will be a lot of doctors who say we can pull this stuff out of your mouth. You know, they'll offer to do it. When I first found out about this stuff, Dr. Canfield, we were pretty good friends, and we discussed this, and there are very, very strict protocols as far as pulling these things out of your mouth. You guys realize that? You just don't go to, you know, Dr. Jones up the street and say, hey, pull these things out. And Dr. Canfield, she's going to go over the protocols, because it's crazy. And you see the stuff, the video I just played, it reaches every organ, every tissue, and every cell in your body. It doesn't go away, even if your fillings, no matter how old they are. They showed you that tooth. That was a 25-year-old tooth. I mean, that stuff stays with you forever. It just doesn't go away unless you do something different. And as far as the protocols, there's things you do before the removal. There's things you do after the removal as well. And it's a pretty intense process, for lack of a better word, because there's lots to do, you know, and I'll let Dr. Canfield touch on that. But other sources of mercury in our country, how about a flu shot? Okay, one flu shot, you get 25,000 times the amount of mercury the EPA determines to be safe. And when they say, let's take our kids have a flu shot, the same flu shot that a full-grown adult would get, they don't make those things smaller for kids. You guys realize that, right? The same flu shot a 6-month-old gets is what a 30-year-old gets. And of course, they were born, you get 2 shots immediately. You know, and it's just the way we start our country. We wonder why we're so sick, why we got such issues. You know, there's a startling number on autism. Back in 1983, autism affected 1 in 10,000 kids. Okay? As of 2013, that number is now 1 in 88. And the latest research from 2014, it's 1 in 65 kids in this country is developing autism as a result. And of course, the CDC says what? They're safe. They're okay. And you look at the numbers, we've gone from, I was born in '64, we got 4 vaccines. You know, the polio, the smallpox, and now kids, by the time they reach 10 years of age, they're receiving upwards of almost 100 different vaccinations. We wonder why kids are so sick and why we're out of control. But we've got people with their head in their sand. They're just denying this stuff is actually happening. But when the research, actually the CDC found out last year, they were actually covering up a lot of the data. They know this stuff causes autism. So I'm kind of off topic. This is a picture of a brain. And once again, they know that mercury, they know it has affinity for the neural tissue, and it actually eats your brain, for lack of a better term. So that's kind of scary when you think about it. Yeah. What you've just seen, half the dentists in this country still use this stuff. Europe's already banned it. But it's okay in our country. Okay, they know it poisons sheep, they know it poisons monkeys, but it must be okay for us. It's okay for the Tin Man, though. All right? So what do you do now? Seriously, what do you do now? If you have amalgams, of course you have to have them removed. I mean, it's not really an option. It's something that's got to be taken care of. And for example, if you're going through any of you guys, like any of our natural cancer centers, you guys know what I'm talking about, where they actually, like the Gershon Institute and whatnot, a lot of those places, before they accept you as a patient, they will want to make sure that you've had your amalgams removed, because they know they can't help you because you're still toxic. Okay, the cancer doctors know this, but the rest of the world does not.
I am a member of the American Dental Association that governs over dentists in the United States. Pretty much, if you're a dentist, you have to be a member. The government, you don't have an option. So you don't. So they kind of tell us what we can and what we can't do. So with that being said, mercury is actually what we call amalgam fillings. And mercury is in the amalgam filling. So amalgam means mercury plus a mixture of metals. And some of you guys were here when we were talking about this before, but nowadays it's 50% mercury and then the rest is zinc and copper. Used to be back in the earlys, we have come some degree better. Used to be it was 70% mercury and then the rest was zinc and copper. But there's even some studies now saying that the more copper that's mixed with mercury actually causes more problems. ALS, MS increased since that's occurred. So even though we've decreased mercury, whenever mercury and copper, and I don't know if anybody is good with metals, you may be able to tell me why, I'm not sure why that is, but anyhow, that is one thing that they have noticed in studies. Most of the studies done in dental relations with mercury and amalgams kind of get slid under the table. So there's a lot of studies out there that were done in the early, like 1900s, and then it went up to like the 1980s. And then since then, there's really not any regulations for dentists when it comes to this, which is kind of the scary part. I mean, there is really no regulations. It started out back in the early, like 1830s. There was the National Association of Dental Surgeons, and they, whenever amalgam fillings came about, they did not want dentists to use them. And it was a big controversy. They actually split up, became two organizations over this subject. Dentists still use them because they're cheap. I mean, it's much cheaper to use than the composite resins or the crowns or anything like that. It's much cheaper for the patient. It's much cheaper for the dentist. So on the bottom line. So they split up. Actually, the NSAD kind of washed away, in the American Dental Association that still exists today. They decided that mercury amalgam fillings were fine, that they were safe. They were so tightly bonded molecules that they do not leach out into your system. So they deemed that it was fine. Around 1985, there was a study that kind of controversial to that. Several studies actually, and the ADA still said that they support dentists in using amalgam fillings. So I think it was in 2009 that the FDA stepped in and said that we will allow it to be safe for dentists to use amalgam fillings still, but there has to be a warning on the label. And Dr. Mark showed you the warning. So theoretically, if you're a dentist, you should tell your patients the options, and you should tell them the warnings of what mercury will do to your system, what is in amalgam, because some people don't know. I mean, we call them amalgam or silver fillings. They don't know really what's in them. So anyhow, you were supposed to be able to disclose that to your patients. Well, it's not governed. I mean, there's nobody standing over you telling you that you have to do that. So that's what the FDA did in 2009. As far as that goes, there's really not been a lot of research on mercury as far as in the dental aspect of it, because the ADA, there's so many other materials used today with the composites, and that, they say, that there's not been a lot of dental research done in the dental field on it, because the ADA does not really support that. So the other thing that's kind of bad with dentistry is that we're not even regulated with what goes into our water systems. So when we take out our mercury or silver fillings, and they go through into the main water stream. So now, it's like Dr. Mark was saying, Sweden is one that's huge. They've banned amalgam fillings. I mean, you can't do them. I mean, and most of Europe has. They're way ahead of us. But as far as even what goes into their water supply is, but here we have no regulations of how we even get rid of it. The FDA stepped up, and they're kind of looking to regulate this in dental offices to be able to put some kind of trap or something that we should use. But it got waylaid, and now they're going to bring it back up in February. Nothing's ever been done. So, I mean, here at my office, we have 2 traps that catches things, but there's no regulation to it as far as that goes. California and Maine are the only 2 states that kind of went out on their own, and they have started to ban amalgams. They regulate what goes into the water system, and as far as that goes. So they're saying maybe in 2015, dentistry will be regulated as far as how we dispose of amalgam fillings. As far as Dr. Mark touched on this, mercury being leached into your mouth, hot and cold, when you drink something hot or cold, it contracts or expands the silver filling. So when it does that, that's when the mercury is leached out. It also causes damages to your teeth as well. So from a dental aspect, from a dentist, a lot of times when you have big silver fillings, you'll notice like a grain of the tooth structure or even fractures going down it, and it's because they expand and contract. The composite resins don't do that as much, so they're actually better for your tooth structure. The disadvantage with the composite resins is sometimes they don't have the longevity, the life longevity. So, you know, 30 years you may get with an amalgam that leaches mercury, but, you know, you may only get 10 years out of a composite resin. So it's kind of the crowns are a little different. They're a more stable structure. They're made of porcelain. So that's another option that you can use. The other thing is clenching and grinding your teeth makes it hot, and so that is another way that it can be leached into your mouth. Besides removal, replacing it, things like that. I don't place amalgams, obviously, in my office, but whenever you get it, I mean, there's a little dispenser that's the mercury and the little tablets of the metal, and so you click them into a little vial, and it shakes up in a shaker. So, I mean, we have mercury spill kits if you do it in your, I mean, it's a hazardous material. I mean, if you spill it, there's a mercury spill kit. I mean, you're supposed to wear these clothing, but still we put it into our mouths. So, I don't know. You can look at that different ways. Otherwise, so when I do removal of amalgams, there's several different protocols out there, different ways to do it. I usually recommend, Dr. Mark's got a great handout to kind of how to take detox, charcoal, vitamin C before you kind of educate on how to do that. I really recommend that. But I do have a protocol at my office if you don't have somebody that walks you through that. But you really want to be healthy. I mean, good diet before your immune system build up. I recommend that you get them taken out within 30 days, all of them, just so that your immune system has, you want to do it 48 hours in between appointments, but you want to get them all done within 30 days, so that way your immune system's not constantly battling. But you also want to give your immune system time to rest. Don't usually like to cross the midline whenever we do them, so with injections, we try to keep it on one side, and then we can do all one side, and then we give you 48 hours to rest and get you back to do the other side, depending on how many you have and what you have to do. Otherwise, usually we give an alternate air source when we do it. We use a high-speed, high-volume suction. We use a high-speed handpiece that can actually section out the amalgam. You don't want to sit there and just like slowly polish it and grind it away, because the hotter it gets, even though we use water, the heat is what releases the vapor. A rubber dam, which is basically a clamp that goes around your tooth and isolates your tooth so that all the particles that would happen to fly would be caught in the rubber dam, what we don't catch in our high-volume suction. Otherwise, I mean, it's pretty easy, the removal. It's the detox afterwards and the before getting healthy, and that is more of the strenuous part on you all. And everybody, I think, and Dr. Mark can ask this, but I think it's individualized too of how you respond to mercury, to amalgam fillings, and how you respond to the healing process. You know, a healthy, like I was telling you, a healthy 20-year-old boy gets his amalgams out and done the right way, you're probably not going to have, I mean, you're going to rebound pretty quickly. But you have someone that's immune compromised, it's going to be a different story. And I think that my big thing is people that are uncontrolled diabetics or uncontrolled or autoimmune diseases that they can't, last resort, they can't figure out what to look for. It's interesting when it comes to the last resort to get your amalgams out that nobody's thought of that, to do that. Then he was talking about cancer patients. That's a good point.